Guys, are you having pain while bending forward? Let me show you some helpful ways that you can use to help reduce pain when reaching for the floor, picking things up. All right. So the first thing I'm going to show you is a seated bending forward, a seated flexion. Super easy, but people don't think about this because I'm sure when you're bending forward and you're reaching down, you feel that pain in your back and you're scared of doing it. Well, by grading the exposure or by slowly introducing you to things that you're kind of afraid of, you can help reduce that pain and even make these movements pretty simple. So the seated one that I do is if you're just sitting here, reach your hands down and you're going to reach between your feet. And you're going to let your back round and you're going to come right back up. So your back is going to round one vertebrae at a time coming forward, and when it comes up, it's going to round back and it's going to snap back up. Okay? I can tell what. Same thing. From the side, it's here, you're sitting and you're reaching down, your back's rounding, and you're coming back up, and it rounds back up. So it's going like this and like that. We're grading the exposure. We're starting super easy with an exercise that you can handle pretty easily, and then we're gonna slowly build up the system to make it harder. So that's exercise number one. All right, guys, so exercise number two is also very simple. You're gonna lay on your back, and you're simply gonna pull your knees to your chest and hold them here. So even this for some people is painful. If you have that kind of back pain, it's that acute, it's going to be really painful even when it's just rounding when you're laying down. So by pulling your knees to your chest, you can practice and play with rounding it just enough, and you can see the positions that are tight and just kind of hold it there. If you find a tight position, you're going to hold it there and just breathe for a few seconds and then come back. Then find another angle. You can rotate your hips a little bit, hold it there, breathe for a couple seconds, and come back. So you can utilize this kind of exercise to experience that low back flexion without having to make it hurt really bad. And the same rules apply as the seated one, where you're going to find the spot that's kind of painful and then relax into it and just breathe, and then come back to a more neutral position where your back is flat and do it again. Once again, you can do 10 to 15 reps of this and just let yourself feel that out, okay? The third exercise we're going to be standing for, and we're just going to stand up nice and tall, and you're going to slide your hands down your thighs to your shins and touch your toes. You're going to come back up, and you're going to round up like that, all right? So if you imagine your spine is doing the same motion that happened during the seated exercise, where it's like one vertebrae at a time, all the way from your cervical spine to your mid-back and your lumbar spine, and then it's going to come back up like a snake. So same thing. You're going to round here, keep your back moving one vertebrae at a time, like a really bad deadlift form. This is the only time we like to do this, when it's not loaded. And then you're going to come straight up like this, okay? The same thing, round, come forward, and reach down like that. All right? So we like to call those Jefferson squats. Sometimes we can do that with weight, and we can progress to that later on. All right, so now we're using the wall for a little tactile feedback for exercise number 4. This is a true Jefferson squat. You have the weight in your hands right here just to create a little bit of downward pull. And you're going to start with your feet a little bit in front. You're going to pull your head off the wall, tuck your chin, and your thoracic spine is going to come off. Mid-back, you're going to feel each vertebrae pull off. You're going to drop the weight between your feet, and you're going to reverse the action. Come up, you're going to feel your lumbar spine touch. L5, L4, L3, L2, L1. T12 all the way up to the thoracic spine, and then back to the head touching, okay? You should feel no sharp pain at all during this exercise. If you do, you have to lower the weight. I use a weight substantial enough that I could handle, but you could literally start this off, obviously, with no weight. That's actually what I recommend for most people, just because it is potentially a dangerous exercise. Only load it as much as you can handle, and I would say to start, just do body weight. Slide your hands down your thighs, just like we did with the previous exercise. But always know you can use the wall, some tactile feedback. Imagine your back coming off the wall like Velcro coming off of a piece of Velcro, where it's peeling off one part at a time, and then we can come up the opposite direction, and you're going to feel each vertebrae touch. And that's a great way to strengthen the way that your mind sees each vertebrae moving, and to make you feel a little bit more resilient in that low back. Because a lot of that flexion and tolerance that we have is not really, it's not because your back is very weak or because it's messed up. It's because you're afraid to do it. It's not because you're actually that fragile. So we're reteaching our body not to be fragile. And that's why we want to slowly progress some of this graded movement so you can eventually do the most. And that's where the fifth exercise comes into play, which is a more diagonal motion, right? So you can do the same thing. You're pulling off the wall, and you could reach both hands down one side and then come back up. And then you could go the same thing, but the other way, pulling off the wall one vertebrae at a time, and then coming up L5, L4, L3, L2, L1, T12, 11, 10, 9, 8, 7, 6, all the way down till you touch your head again, and you're rotating as you're doing it. You make those rotations bigger and bigger every time until eventually you're getting a whole big range of motion between those movements. Now, once you're good at that and you have no pain with that and you're very strong and you're feeling confident, you can grab another kettlebell and you can start doing some reaches with some rotation like this, then come down the other side. Then you're rounding your back just a little bit and you're reaching up, and then you're switching hands like that. You can usually come down with both hands to one side and then up that shin, just follow the line. And the same thing over here. And you're kind of feeling that stretch all along that QL, the erector spinae on that side. You're letting everything stretch over, even your lat. And you're finding a way to get a stretch along these planes of movement that you were previously afraid of. Thus the graded exposure. Exposing yourself to more and more motion. So eventually you're doing crazy things like windmills, which is our neck exercise, where you're here and you can reach down and then come up the other way. And like that, and come there. So you're rotating, you're twisting, you're bending, you're pushing your hips back, you're loading your spine in ways that you might have been previously afraid to even bend forward to pick up something off the floor because you're so careful. So my advice on all these exercises is to start small. With all of them, actually, I wouldn't even recommend adding weight to them until you're able to work your way through all of them with no weight. And then you can add a little bit of weight. Just make sure you're balancing that out with other exercise that isn't just bending forward with weight all day. So try out these graded exposure exercises for flexion and tolerance for low back pain. I think that'll be really helpful for a lot of people that have trouble bending forward. If you have any questions or concerns, you could comment, like, subscribe. You can even message me on Instagram at Dr. Rob Polizuk. Thank you. Have a great day.